It is really common for women to have almost no understanding of their own anatomy.
Myths and misinformation about women's sexual health are rampant, especially when it comes to pleasure.
I have had women who really haven't a good idea about where their clitoris is.
It's the bulb right here, but the clitoris also extends to here and here.
In sex ed in school, we don't tell them that if they can't have an orgasm, they should probably talk to someone about that. That never gets mentioned. They just get told, don't get pregnant.
The doctors I spoke with say this lack of information can leave women feeling frustrated.
At least 2 to 3 times a week, I am convincing women that penetration is not the thing that is supposed to give them an orgasm. That's not how it works for most women.
The other concern that doctors hear from women again and again is that you either have desire or you don't.
My libido went somewhere, I don't know, maybe went back home, not sure. I haven't been able to connect and enjoy sexually my interaction with my husband.
But doctors say there is no normal libido. Your desire for sex might just be different than your partner's. Canadian women can go to clinics for things like STIs and questions about contraception and pregnancy. But the majority of women don't have access to someone who specializes in sexual health, who they can talk to about things like orgasms and libido.
And when they do, it's often met with embarrassment on the part of the provider, shame on the part of the person. Unfortunately, often it results in dismissal, misinformation, or just frankly, no information.
Right. Part of improving this is learning about our anatomy, learning the correct terms.
That's why at Dr. Finn's office, she asks her patients if they're comfortable holding up a mirror and getting a guided tour of their vulva. The idea is that if you can name the parts, then you can ask for specific help from your primary care provider.